Advertisement. You can use several channels to publicise your health awareness campaign. Social media is a useful tool for reaching a wide audience. Facebook events and countdowns on Twitter or Instagram are just a couple of the ways to raise interest and ensure maximum attendance at your events. You could approach nearby community or religious centres, such as your local church or temple, and invite their community members to attend also. The health team produces a poster template for the RHAC campaign each year, which can be personalised and tailored to the events at your centre. Once you have the dates, times, venues and details of any speakers and collaborating organisations, contact your health team representative to arrange for posters to be produced. These can be shared on social media. We would also recommend contacting your centre and requesting permission to display and distribute posters, make announcements during programmes, and circulate reminders via the centre's mailing list. Volunteer recruitment. We ask that everyone who wishes to volunteer fill out a Google form with their name, contact details and preferred roles. These roles could include giving a health talk, helping to organise a green iftar, running a health screening event, data collection, or an organisational or administration role. The key thing is, in RHAC, there is a role for everyone, whether healthcare or non-healthcare based. The Google form link will be emailed out to you following this training video. Additionally, your health team rep will be able to pass you details from our volunteer bank of people who have helped out in previous campaigns. This may be a good starting point, but be sure to advertise to a wider audience to recruit as many enthusiastic volunteers as you may need. The same advertising principles apply as with the previous slide. You can use social media, posters, announcements during centre programmes, and generate interest via the centre's mailing list. All volunteers will receive a certificate to recognise their efforts. Once your RHAC campaign is complete, email the names of all your volunteers to your health team rep, and we will produce the certificates for you to send out. More details of how to allocate volunteers for roles during health screening events will be addressed later on. Equipment and health material. Once you have decided which stations you will set up at your screening event, make a list of any equipment and health material you may need. Where possible, you should ask volunteers to bring their own equipment, such as disposable mirrors for dentists or weighing scales for the BMI station. If you are unable to source equipment, please liaise with your named supervisor for further suggestions. The Central Health Team has ongoing relations with some national organisations and can arrange for some material to be delivered directly to your centre. You can also contact local health and social care organisations, charities and hospices to either provide you with leaflets and information booklets or to attend your screening and run a stall or station. The possibilities are endless and can be tailored to suit your community's needs.
The Google Drive. The Google Drive will give you access to all the resources you need in order to carry out a successful campaign. You will have registration, medical and feedback forms available to use in the screening, alongside guidelines on how to conduct a screening efficiently. It will also contain some guidelines and information on the green iftar and a template PowerPoint presentation for the health talks. Any other content that may be helpful will also be shared via the Drive. You will be given access to a generic folder that will have all these resources. Additionally, you will also get access to a separate Google Drive folder that is specific to your centre. In this folder, there will be information from any past campaigns conducted at your centre, such as volunteer lists or screening databases, and will also be a platform where you can upload this year's content from your campaign, such as your screening database, health talks presentations that you conducted, and any pictures that you've taken. If you have any technical issues, just get in touch with your named supervisor and they'll help you out.
Photos. We would also encourage you to take as many photographs as possible during the event. These can be shared on social media to publicise the campaign, shared with your named supervisor via WhatsApp, and should also be uploaded to your centre's Google Drive so they can be included in our annual report. Please do ask permission of any attendees and volunteers before taking and uploading photographs. Post-event. Following your health screening event, there are several important tasks to be completed. We would recommend you make a stock list of all equipment, such as blood pressure monitors, as well as disposable items, such as gloves and glucose test strips. This inventory will be extremely helpful for future events. If you are unsure of where to store these items, please contact your named supervisor, who can advise you accordingly. It is important to send a message of gratitude to recognise your volunteers and collaborating organisations' efforts. There are templates available for this on the Google Drive, which you can tailor to your centre. Additionally, we will provide personalised certificates for all volunteers. Details for this will be discussed shortly. Feedback is extremely valuable to us, as it helps us to improve future events and campaigns. Formal feedback will be discussed on the next slide. However, we would also request that you have a debrief session on the phone with your named supervisor to discuss what you felt went well and what could be improved. This could include thoughts on your work, our supervision, working with your centres and volunteers, training such as this video, and any ideas you have for further work. Feedback and certificates. Feedback is essential to improving the Ramadan health awareness campaign. It's useful to know what went well and what could have gone better. We will provide links to 2 Google forms, one for volunteers and another for attendees. We would strongly recommend you ask attendees to fill out their feedback forms at the final data entry station while you are entering their health data onto the RHAC database. It is advisable to print out paper feedback forms for attendees to fill, particularly if you do not have many laptops available on the day. The RHAC team provide a certificate of participation for all volunteers. We ask that each volunteer fill out a Google form with feedback, regardless of which aspect of the campaign they took part in, as we value the thoughts of those working on the ground to deliver the campaign. Following this, we request that you, as centre representatives, send us a list of volunteers from all events at your centre, so that we can produce a personalised certificate for you to email out. Thank you for listening. If you have any questions, queries or comments, please do not hesitate to get in touch. You can email the MSc Health team on ramadhanhac@gmail.com. We wish you all the best with your health campaigns and look forward to working with you.